Here at the Conquest, we have our own specific medical on-call, which incorporates two SHOs for the clerking, one's for medicine, and one's for care of the elderly, or DME as we call it. You're supported by a medical registrar who pretty much runs the shop floor, and there's the acute assessment unit, or really acute medical unit, which is staffed by its own acute consultants and its own staff, junior doctor support, which will help also with seeing all those patients on AAU, but also to help with clerking when required. They also have their own dedicated twilight AAU doctor who will help with the clerking later towards the evening, and you have a house officer covering the wards from 5 p.m. onwards. That shift runs roughly from 8:30 to 8:30 in the evening, handover.
When you join us in medicine, you'll receive an online login for Medics Online or Health Roster, and that allows you to view your on-call commitments and your rota, your 0 days. It's also the portal for which you can request your annual leave and your study leave form. When requesting your annual leave, we do ask that you try and work around your on-call commitments, as this allows us to make sure that ward cover is planned. If you do need to request annual leave and you're on call, we ask that you speak to your colleagues and try and arrange a swap. Once you have a swap arranged, you then need to go to your administrator, who is Paula Bradbury, and she will make sure that swap works for both the teams, and your annual leave will then be approved and it will be held online.
My name's Elizabeth. I work on the acute assessment unit as one of the nursing sisters. This is a very busy unit. We take referrals from the GP surgeries and from A&E next door. We have an ambulatory care clinic which has patients coming in day to day for various treatments so that they don't have to come into hospital for an overnight stay. We welcome junior doctors. In fact, we welcome all doctors from all over the trust. We like to pride ourselves in helping our junior doctors with their doctor's education, and also to help them settle into the ward.
Do 1 in 8, so every 8 days you're the F1 on call for the hospital, and that means that if it's during the week you do your normal day job until 5 p.m, and then you're the on-call F1, finishing any tasks that other medical teams haven't been able to finish, or answering the bleep for nurses who are concerned about patients, and then going to review those patients and escalating as necessary.
As an SHO in medicine, your on-call shift will start at 8:30 in the morning, so you head up to the acute assessment unit, pick up your on-call bleep, and then throughout the day you'll then be responsible for taking referrals from A&E for medical admissions. Throughout the day it can be quite quiet, or it can be quite busy, or somewhere in between. You'll normally hang out on your parent ward until your bleep goes off to take a referral. Once you've taken your referral, as long as you're happy with the referral, you go up and clerk the patient in, taking a history, coming up with a management plan, and then later on you'll post-take that same patient with the consultant, the on-call consultant for the day. I mean, medical take can vary from having 5 admissions a day to up to 20, 25 admissions a day, so it can vary in how busy your workload can be. Whilst you're on call, you also carry the crash bleep, so any cardiac arrests in the hospital, you'll be responsible for going to and attending them. Whilst you're on call, it's important to make sure you take your breaks, get enough rest, and make sure you're well fed. And I think the trust do try and encourage you to do that as much as you can. There is good support from the medical registrar, so if you're ever unsure about anything, or you're seeing a patient that you're not really sure what to do, then they're always just a call away. And then again, you've got your consultant post-taking that patient later that day to just go over your management plan or make any changes to things. And then that's a good way to get some feedback on your management plan and, you know, improve your learning and further your training.
The weekend on call is staffed primarily by the medical registrar. You have a house officer covering the wards, who's then supported by a twilight senior house officer who starts from roughly 1 p.m. onwards. On top of that, you have a medical SHO and a care of the elderly SHO doing the clerking, and you're supported also by consultants on the acute assessment unit, as well as junior staff on the acute assessment unit. The key message, I think, for the weekend on call is that while it can be busy, you are supported, and you should always not feel afraid to ask the registrar if there's some difficulties. It's about communicating within the group so everyone supports each other especially.
2 or 3 weekends in a 4-month rotation on call, covering ward jobs, reviewing bloods, reviewing patients that the day teams have asked you to review over the weekend, and also answering bleeps from all the wards, from all the medical wards, from any nurses that have concerns about patients. F1s in medicine don't do nights.
The night on call is staffed by a selection of the hospital at night team. From a medical side, that will be the medical registrar and an SHO. But you are supported by 2 site nurse practitioners or site managers. And the beauty of the system is that they will normally field most of the calls to the senior house officer or call medical trainee to filter out cases that they can help with, so that mainly the most important things come through to the medical team instead. So that runs overnight. You're also supported by the outreach and ITU registrar and SHO. So overall, it's a fairly comprehensive cover for the sickest patients. So we make sure that the registrar and the SHO are communicating with all the specialties, particularly at the handover time, so that all the different disciplines know who's the sickest patients and what supports are needed.
Your night shift will always start with a handover at 8:30 p.m. And so that will be in A&E, in the doctor's office over there. And over there you'll meet the day team, have a handover of all the patients that have come in that day. Any jobs that need to be done for any of those will be handed over to you. So any blood tests or scans that need to be chased, you then get handed over. Any patients that are waiting to be seen that haven't been seen in the day, then you kind of have a brief overview of what to expect from those patients. And any patients that have been sick throughout the day on the wards, then you also get handed over those. So there's an effective handover, so you're kind of fully prepped for the night shift in terms of patients that might go off, patients just to be aware of, or any things that need chasing.
So one of our priorities is to make sure that our junior doctors on the on-call are supported. And that's very important regardless. It's going to be a busy job, whatever the case, and it will fluctuate from being a bit quiet to being very busy at certain times, which can be stressful. The important thing is that we work as a group. When you're feeling like things are a bit out of your depth, you need to let your senior know, and we're very happy to hear about things. As a whole, we can then delegate tasks and help divide the burden across the group. And we've got the medical registrar who can support you, as well as the rest of the site nurse practitioners and everyone else to give you a hand. So really, there's no reason to feel that you're alone. You really aren't. Just ask around and people will help you.